We have been talking about PANS and PANDAS, and we've been talking about some of the integrated treatment modalities that we've been using to manage this condition. One of the more crucial kind of modality to manage PANS or PANDAS is functional medicine and nutrition. So food as medicine is a very powerful modality. And we have Ms. Brenda Gregory with us, and I will let her introduce herself. Hi, Brenda.
Hi, it's good to be here. My name is Brenda Gregory. I'm a functional medicine nutritionist, and I work with all kinds of issues, from people just wanting to get a little bit healthier and understand how food affects their lives, and understanding a little bit more about food and physiology, to those with chronic diseases, autoimmune conditions, PANS, PANDAS, just helping to get to the root of what's going on. Functional medicine is a little bit different from conventional in that it's really root cause. We want to figure out, how did this actually start? So, I'll use PANS, PANDAS. So if there are behavioral issues that are being noticed, a lot of times there will be digestive issues that go along with that. So rather than just giving, medications and saying this is just the way it is, we'll actually go in and figure out what's happening with the gut. Why is there pain? Why is this causing maybe serotonin dysregulation or neurotransmitter dysregulation, inflammation within the body? How do we change up the diet? What supplements can help to supplement the healing, not put a bandage over it, but just actually really figure out, what is the root of this problem? When did this start? How did this start? And how do we actually fix it so that we can make it go away? Leaky gut. What is leaky gut? It's a term that's around and everybody's heard it, but we don't really know. And it's a question that I get often in my office. Well, okay, I think I have leaky gut, or I've been told I have leaky gut, but what is it? So
Right.
as we're digesting our food, secreting saliva enzymes to digest carbohydrates and chewing really well, moves down the esophagus, down to the stomach, and breaks down fats and proteins. And as those are broken down, they move into the small intestine. And the small intestine, as you can see on the slide, has these cells that are they're stuck together very tightly, and this is the way that it should be. So as we're digesting food, breaking it down into smaller and smaller pieces, the small intestine is what actually takes in the nutrients. It decides what goes in and what stays out and moves down to the large intestine to be removed from the body. And so when you have small intestinal cells that essentially come apart, like in the second slide, then this is leaky gut. So the food that's being broken down, large protein structures escape it, okay? And so when that happens, we can develop food sensitivities, because the immune system knows two things: self and not self. So logically, our brains know that it's food, but the immune system doesn't recognize that. So if it's escaping outside the gut, then that can cause a food sensitivity, because the immune system flags that food as problematic. It sees it as a pathogen. There are a number of things that can cause this leaky gut. Chronic infections is one of those things. Dysbiotic gut, so too many bad bacteria, not enough good bacteria. So the intestinal cells that we showed in that slide, those junctions, so it's almost like Velcro that holds the intestinal cells together, right? They're supposed to come apart if we need to flood the intestines with water, maybe too many pathogens, a parasite infection, E. coli, something like that, right? So if they're supposed to come apart. If they stay apart, this Velcro begins to degrade. Okay, so these junctions begin to degrade. And what they found in the research is that the blood brain barrier, so the barrier that keeps things out of the brain that should not be there and allows only certain compounds, just like the small intestine, to be absorbed, can become leaky as well. These are the exact same junctions. And the research has shown that someone who has no digestive issues, no leaky gut, within 6 hours of a traumatic brain injury, will end up having leaky brain and leaky gut. And so it's the same. We know that if we have leaky gut, we know we have a leaky brain.
Right. And then addressing all of this through the gut integrity. What does gut work look like? So you talked a little bit about foods. You talked a little bit about inflammation. Um, what kind of things do you do with people to help heal their gut?
So a number of things. We can run some functional labs, and we can take a look at, what foods are causing inflammation. So we can get those out of the diet because we know that when we have foods that are causing an inflammatory response, right? They're leaking outside the gut, flagging the immune system. That also leads to more leaky gut. So leaky gut, food sensitivities, more leaky gut. It's just this cycle that happens. So we want to figure out which foods are actually problematic. Pull those out of the diet, and it's never, not, I shouldn't say never, but it's often not permanent, but we do it for a while we'll do some gut healing. Um, and then we'll also take a look at potential neural inflammation. So what parts of the brain are inflamed? Are there any antibodies? So is there any autoimmunity starting to happen within the brain, which is also just another flag that we need to bring the inflammation down. And then while we do that, we might look at some stool as well. So if we look at a stool sample, then we're looking at the microbiome. Okay, so what's in the microbiome? Is there a wide variety of good probiotic bacteria? These bacteria can be very anti-inflammatory on their own. So in order to do that, we have to take a look at diet. So what is the macro? Okay, the proteins, the fats, the carbohydrates. Is the ratio right for that particular individual? So then are they getting enough calories with those whole foods? And then also we need to look at the micronutrient status. So are we getting enough of is this person getting enough of all the minerals and vitamins that they actually need in order to rebuild the gut, to create the neurotransmitters that their brain needs, to create the or to use foods that are anti-inflammatory to help bring the inflammation down. So we really take a deep dive into the diet along with that gut.
So a child with PANS or PANDAS, and if let's say suddenly there's a change in a child's personality in which they start having problems with obsessive compulsive disorder. Their basal ganglia are inflamed. They start having changes in diet. They start having problems with stomach pain sometimes. And then, of course, they can start having anxiety, texture sensitivities when the basal ganglia get involved, and all of those things. So what you were talking about was addressing the gut, and the gut would have an effect on the immunity, and the immunity is the problem with PANS and PANDAS, right?
Yes.
So,
Yes.
so that is one way to get at the immune system.
Yes, absolutely. Absolutely. We've got to reduce the inflammation, figure out what is causing the inflammation so that we can reduce that, find the infections that may be going on, and use the right herbal remedies and medications, whatever it takes to start bringing that down so we can get control over the immune system and let the immune system re-regulate itself.
So this is just one more example, and our series has been about talking about PANS and PANDAS. about the various types of modalities that exist and hope that exists for families and for children of families. So this is one of the ways that we try to approach this and manage this condition in our clinic. It's a pleasure to be working with you, Brenda.
Same.
And thank you for coming along and sharing your knowledge with us.
Yes, thank you for having me on all these journeys. I love it. So I'm happy to be working with you.